Na msodata kabisa mpenzi mtazamaji, ni matumaini yangu kwamba uko mzima buheri wa afya. Matangazo haya tunakupeperushia moja kwa moja kutoka hapa katika jiji la Nairobi. Hii ni Shina La Upeo. Tunaanza na taarifa ya tanzia, ambapo watu 5 wamefariki mapema leo kufuatia ajali ya barabarani iliyotokea eneo la Laini, takriban kilomita 10 kutoka mjini Naivasha. Wengine 4 wamepokea matibabu katika hospitali ya kaunti mjini Naivasha. 3 miongoni mwao walifariki papo hapo, huku wengine 2 wakifariki walipokuwa wakipokea matibabu katika hospitali ya Naivasha. Walioshuhudia ajali hiyo wameelezea kuwa huenda gari lenyewe lilikosa breki kabla ya kubingiria mara kadhaa. Wenzao waliokuwa katika gari tofauti walielezea kuwa wamekuwa katika mkutano jijini Nairobi kwa siku 2 na gari hilo lilikuwa limewabeba wafanyakazi wa Mega Wholesales kuelekea mjini Eldoret.
Aliweza kupita kando ya barabara wakati alikumbuka breki imekatika, na akaweza kuokoa watu wengi, manaka akipita kwa barabara ingekuwa accident kubwa sana.
Wangeanzia huko mbali na weke saini kubwa sana ya kwamba hapa kuna nini, it's dangerous, ndio unaonea mbali. Ukionea mbali, ukifika hapo utakuwa unajua.
Wengine wako stable kidogo.
Na bila shaka mtazamaji, ni taarifa ya kusikitisha mno. Mwenyezi Mungu ailaze roho yao mahali pema peponi. Tukiachana na hayo, kwingineko ni kwamba vuguvugu la kongamano la mageuzi limetilia shaka uwezekano wa mahakama wa kupitisha mswada wa usawa wa jinsia. Vuguvugu hilo linasema kwamba serikali imefeli na hivyo basi Rais Uhuru Kenyatta anafaa kuvunja bunge na kustaafu. Aidha, wanadokeza kuwa mahakama inatumika kupiga siasa. Aliyekuwa jaji mkuu Willy Mutunga sasa anasema kuwa viongozi waliowekwa uongozini kisheria wamekosa kufuata sheria ipasavyo.
So the position is that even if there are court cases going on, the people have still that power, to raise issues. The Bill of Rights gives you the right to express yourself, and that's the beauty of that constitution, that it does give you, these rights. And Kongamano la Mageuzi is giving, in my view, Kenyans a new view of what the people's opposition should be. That is the people themselves that have to breathe life into the constitution. You can have an opposition that is captured, as the current one was, all right? But that doesn't mean that people cannot organize, cannot demand, particular rights, and that's what the constitution is about. An opportunity like COVID-19 gave us the opportunity to make demands that we are not making before.
Hatuna imani kwamba process ya mahakama iliyopo ni strategy tu ya kuchelewesha uamuzi, lakini tutaipa mahakama muda kujadili kesi ambazo zimefikishwa mbele ya mahakama kuu, lakini tukijua kwamba haitakuwa mara ya kwanza kwamba serikali ya Uhuru na Ruto wamekataa kutekeleza maagizo ya mahakama. Kwa hivyo ndio kuna process ya mahakamani ambayo tunaiheshimu, lakini hatimaye itakuwa ni juhudi na nguvu ya umma kuishurutisha serikali kuimplement katiba inavyostahili.
Naam, tukiachana na haya, kwingineko ni kwamba baadhi ya viongozi kutoka jamii ya Kikuyu wamejiepusha na wenzao walioenda kumtawaza kinara wa ODM Raila Odinga wiki jana huko Bondo. Viongozi hao walio chini ya kiama wanasema kwamba kundi lililoenda kumtembelea aliyekuwa waziri mkuu kinara wa ODM Raila Odinga hawakutumwa na baraza la wazee au Rais Kenyatta, ila walienda kwa kujitolea wenyewe. Wikendi iliyopita aliyekuwa waziri mkuu Raila Odinga aliwakaribisha viongozi wa jamii ya Kikuyu nyumbani kwake, wengi wakitaja kama matayarisho ya kuwania urais mwaka 2022.
Hii maneno ya watu kwenda huko Bondo, sisi kama wazee wa chama hii ya ukweli ama chama ya kiama hatuko huko. Yule mtu ameenda huko, ameenda kivyake. Na tumemuuliza kwa njia mzuri kabisa, awache kutumia chama ya ukweli kiama kwa njia mbaya. Kwa vile anaenda huko, anajitafutia yeye mwenyewe juu ya jaa yake, na sisi wa Kikuyu si watu wa kuuzwa kama jugu karaga. Sisi tumejipanga vizuri, hatuwezi pelekwa soko na mtu ambaye anajitafutia. Apeleke jaa yake huko, ajitafutie huko, lakini sisi hawachane na sisi.
Wazee wa kiama hawaendagi pahali ni kukutwa anakutagwa. Mtu hawezi akaenda ati mkute huko kwa bedroom bila hao watu walifanya. Ni kukuja hapa halafu tumtawaze kama ni kumtawaza. Lakini hatuwezi tukatawaza Raila Odinga kama kiongozi wetu. Tuna kiongozi yetu anaitwa Uhuru Muigai Kenyatta. Huyo ndio sisi tunafuata na tutaendelea kumfuata. Na wale wengine wanaendelea na kampeni, waache kampeni kwanza, tufanye kazi na rais wetu.
Naam, tukiachana na hayo, kwingineko ni kwamba mbunge wa Matayo Geoffrey Odanga ameitaka Wizara ya Elimu kufanya majadiliano na washikadau wa elimu. Rais Uhuru Kenyatta akishauriwa kutafuta suluhu la jinsi tatizo la uhaba wa madawati litakavyosuluhishwa. Akizungumza na wazazi na wanafunzi katika shule ya upili ya St. Joseph, mbunge huyo ameelezea wasiwasi wake wa kutengeneza madawati sasa hivi, akisema haitawezekana kwa kuzingatia idadi kubwa ya wanafunzi.
Kuna vifaa vya masomo vyote ikiwemo maabara na kadhalika, haviwezi kuwatosheleza wanafunzi wote, hasa ikiwa tunazingatia mambo ya social distancing na kadhalika. Lakini itabidi tuone kwamba wanafunzi wanaweza kuwa shuleni, na nashukuru wizara kwamba imeanza kwanza kwa wanafunzi wa kidato cha 4, darasa la 7 na ile grade 4 kwanza kuweza kuangalia ili tuweze kutathmini na kujua changamoto ambazo zipo. Na vile ndio imefungua shule, zimefungua juma lililopita. Hizo changamoto sasa zinaanza kuonekana. Tunajua kwamba wizara ikikaa pamoja na washikadau wote, jinsi ambavyo rais alisema, tutaweza kuwa na maoni mbalimbali na tutaweza kuwa na njia ambazo zitaweza kufaa. Pengine wanaweza kusema kuwe na ile shift ama staggered, watoto wengine wasome mchana, wengine usiku, mchana na wengine asubuhi, wengine wasome juma hili na wengine juma lijalo. Na ikizidi sana, na hasa ambavyo tunaona kwamba hivi visa vya corona vinaendelea kuzidi, wanaweza sema waendelee tena kuangalia nini itafanyika, kwa sababu vifaa vya shule kujenga si jambo rahisi ya kujenga hivyo kwa muda huu mfupi katika shule zote. Lakini sisi tutajaribu kuhakikisha kwamba kuna nafasi ambazo wanafunzi wanaweza somea. Kwa mfano juzi tulipeana Our Lady of Mercy milioni 4, tukaongeza milioni zingine 2 pia tulikuwa tumefanyia mchango mwaka jana. Wajenge mabweni kwa sababu tunataka hiyo social distance.
Naam, tukiachana na hayo na kurejelea masuala ya siasa, ni kwamba mbunge wa Mumias Mashariki Benjamin Washiali amejitokeza kumtetea naibu rais William Ruto kwa madai ya kuzama katika siasa za mwaka 2022 badala yake kutoa huduma kwa Wakenya. Washiali alizungumza haya alipokuwa eneo la Shanderema, akitaja kwamba ziara ya naibu rais William Ruto ni ya kubadilisha maisha ya watu wanaotaabika kwa sasa, akisisitiza kwamba naibu rais ataendelea na shughuli ya kubadilisha maisha ya Wakenya.
Ninyi mkisikia viongozi wengine wakisema ati Ruto anatembea akifanya campaign, na hili huku sisi anatembea akitusaidia, mnaweza kubaliana na wale watu wanasema ati Ruto anatembea akifanya campaign kweli? Juzi Mheshimiwa Ruto alikuja hapa akafanyia harambee vijana wetu wa bodaboda. Hiyo ilikuwa campaign kweli? Juzi alikuja hapa wa viongozi wa kanisa hawa reverends hapa wa Pentecostal churches wote walikuwa hapa Shanda, akafanyia harambee ya kutengeneza guest house ya reverends. Si hiyo ilikuwa jambo mzuri? Wakati ule Ruto amekuwa naibu wa rais kuanzia Mheshimiwa Uhuru Kenyatta awe rais, ati yeye akiwa deputy amefanya nini? So mmesikia wakiuliza swali ya aina hiyo. Success of the Jubilee government will depend with what Uhuru Kenyatta will make, will decide, will develop. Because hata wakati ule ndugu Rais Mwai Kibaki wakati ule alikuwa deputy, hatungejua kwamba alikuwa na ability ya kufanya kazi mpaka wakati ule alichukua kama president baada ya kusafu Moi. Kwa hiyo miaka hiyo yote hatukuwa tumejua Kibaki angefanya kazi mzuri. Mtoto wangu hawezi kuwa hasala kwa sababu yeye hajui maneno ya mraba, hajui maneno ya kuuza kuku, hajui maneno ya bodaboda. Lakini mimi mwenyewe mimi ni hasala ama namna gani? Kwa hivyo kwa Raila Odinga ule alikuwa hasala kwa Odinga, na Odinga baba ya Raila. Raila mwenyewe ni mtu ya blue band.
Naam, tukiachana na hayo, kwingineko ni kwamba seneta wa Makueni Mutula Kilonzo Junior amekashifu siasa zinazoendelezwa baina ya walionazo na wasionazo maarufu hustlers na dynasties. Seneta huyo anasema kwamba taifa la Kenya ni kubwa kuliko wanasiasa wachache kujali maslahi yao. Kilonzo alizungumza alipokuwa kwenye mazishi huko Mboni, akitaja serikali ya Jubilee kama iliyofeli kufuatia kashfa za ufisadi. Aidha, seneta huyo ametaka serikali kuwachukulia hatua waliohusika kwenye sakata ya mabilioni ya korona.
Jubilee is splitting this nation. We have forgotten that in this administration there has been so much corruption. That there has been so much corruption in this government. This is possibly the worst government we'll have in this republic. This country is greater than the hustler nation, than the dynasties. I can repeat that 100 times. This country is bigger than the dynasties and the hustler nation. This is a country of peace-loving people who want basic needs. 6 billion worth of PPEs are stuck in KEMSA. Possibly this is an opportunity for the KEMSA billionaires to start selling those PPEs. Can the Kenya government be truthful to the people of Kenya? We have suffered. People have lost jobs. Hotels have closed. Intercontinental has closed. My mother worked there for 25 years. It has closed. What do you think those cooks are going to do?
Sijui mchango wako ni gani kuhusiana na taarifa hizi na siasa jinsi zilivyo katika taifa letu la Kenya. Kumbuka nambari yetu ya rafa ni 22047 na tovuti ni www.tv47.co.ke. Tukiachana na hayo, kwingineko ni kwamba gavana wa Machakos Alfred Mutua ameendeleza siasa zake za mwaka 2022 katika kaunti ya Laikipia. Katika ziara yake eneo la kati, Mutua amebaini kwamba changamoto kubwa inayokabili taifa hili ni swala la ufisadi, ukabila na ukosefu wa maendeleo. Gavana Mutua ametaja kwamba utengenezaji wa viwanda vitakavyosaidia kubuni nafasi za ajira nchini ni jambo la muhimu sana. Aidha, amewataka Wakenya kukoma kuendeleza siasa za mgawanyiko na kusababisha kuwepo kwa ukabila. Hata hivyo, amemtaka Rais Uhuru Kenyatta kubuni tume ya uchaguzi ili kuandaa uchaguzi wa mwaka 2022 ili kuepuka haraka za dakika za mwisho.
Na bila tumeamua tutadanganywa tena, tumechoka, so we are serious. Na wakati Gavana Mutua ulisimama ukasema unataka kiti ya president, zaidi tulifurahi sana, tulijua sasa mashida yetu utatatua, utatusaidia na utatupeleka mahali pale tulikuwa wakati Kibaki alikuwa.
Ndio mimi nikasema ya kwamba kompyuta ya Kenya imehang. Ukiangalia mahali tuko na mahali tulipaswa kuwa, ukiangalia shida tunazo, computer of Kenya has hung. Inataka mtu ambaye anaweza reboot hiyo computer. Ndio tunasema kwamba we must start afresh. Uhuru Kenyatta, kwa unyenyekevu kabisa, tafadhali, hivi sasa makomishona waliopo ni kama 3 badala ya kuwa 9. Tafadhali harakisha tuko katika miezi 18 kama vile Kriegler report ilisema. Tafadhali unda tume ya kuweza kuadvertise, kuwatafuta Wakenya ambao wanaweza husika, tuhusishe sisi viongozi wa vyama tofauti ndio tuweze kuhusika katika mpango huu, wachague hao, wapeleke pale kwa bunge, wakuwe vetted, ndio tuwe na tume ya uchaguzi IBC mapema kwa mwezi ujao.
Naam, bila shaka mtazamaji, kwa taarifa hiyo, kwa sasa tunapenda kukuletea matangazo ya moja kwa moja kutoka katika jumba la afya ambapo ripoti ya maambukizi ya virusi vya corona kwa sasa inatolewa. Wacha tuvuke moja kwa moja.
That was characterized by symptoms mild enough to ignore. Most of those that caught it treated it like any other flu, and they recovered from it within a matter of days, just as we do today. The first wave of this flu claimed some 75,000 people. But then something very unfortunate happened. Two waves that were more potent and deadly hit back. Unlike today, when we have vaccines and all manner of sophisticated medication, or scientists warning us against looming dangers, such was not the case then. And therefore, when the surges hit, they spread with a contagious vengeance that claimed victims in matters of hours, or at best case scenarios, in a few days without showing any signs of mercy. By the time it was done, the Spanish flu had infected about a third of the world. It wiped out an estimated 50 million lives. And when you ponder about that for a minute, then you begin to understand the complexity of what we are facing today. When COVID-19 started spreading, it was even uncertain as to whether we should even wear masks, a fact that was very quickly clarified by the World Health Organization, with evidence proving that masks is an effective tool against COVID-19 spread. And since then, as was the case with the Spanish flu, citizens have globally been advised, if not mandated, to wear masks in all public places, not only to protect themselves, but others. Fellow Kenyans, while there are stark differences between the casualties of the two pandemics, bearing in mind that one is current and ongoing, the similarities between the two are bare to see. In the few months that it's been with us, the coronavirus has infected 39.6 million people globally, claiming 1.2 million people victims as at yesterday. Sadly, some 825 of those people are our own beloved Kenyans, and there is no sign of the retreat of the virus. Following the nationwide consultations and in response to the public pleas, the government made decisions to lift some of the containment measures it had previously put in place to slow the spread of coronavirus. The opening of the bars, relaxation of rules related to public gatherings, an extension of curfew from 11 p.m. up to 11 p.m. was accorded on the 28th of September with an appeal, repeat, with an appeal to the public and leaders to continue to observe the measures that have been advocated as critical COVID-19 prevention measures. We all know them: face masking, observance of social distancing in public places, and of course continued hand washing with soap, water, or sanitizer. A mere 3 days from that date, we began registering an incline in our COVID-19 positivity rate. On September 1st, it was on October 1st, it was 4%. A day later, on October 2nd, it rose to 7%. On October 3rd, it went to 8%. And it has been, in the period since, marked a consistent upward trajectory. Today, at about 13% incline and a daily rise in deaths, we can confidently point to a potential crisis unless we take some immediate actions to avert this. In other words, we can choose to swim or to sink. Cumulatively, those persons aged between 20 and 39 account for 54% of all positive cases. And the majority of our deaths are among those above the age of 58. But we have also lost Kenyans who are in their 20s and 30s. And today their parents and children are crying over their graves. And it hurts us. And those who have lost Kenyans, those who have lost loved ones, for people to say indeed that there is nothing like COVID. This disease has a tendency of responding to those who say so. And I hope and pray that those saying so will not be treated the same as even global leaders who have denied the disease, only 2 days later succumb to the same. Turning to the majority who are youth, I wish to remind you the following. You are the young parents, the backbone of this economy, the people to whom parents like me hope and anchor our hope on. What happens when you, for instance, go to the pub, get infected, in turn, infect your children who are now back to school? Just think about that for a minute. If you go to school, they in turn will infect another child in school. It will start spreading in schools. They will then go back and infect their grandparents or those of us above 58. And the story can unfold to anyone who is looking at it. And yet, it is indeed true that the younger people are the ones who are taking the greatest risks with this disease and flirting with it. This is not a problem for the youth as such. We are seeing a return to normalcy even amongst health workers. These times are not normal. And please do not treat them normally. Normal behavior will have abnormal consequences. Fellow Kenyans, since we relaxed the measures, we have seen worrying trends in many of our counties. Counties like Kilifi, that had registered remarkable containment, are now back to registering high numbers of positive cases. Other counties like Nakuru, Turkana, Trans Nzoia, Kisii, Kisumu, and Bungoma are also on a worrying trajectory. The spike we are witnessing has not just erupted out of nowhere. It has in part been triggered by wanton violations of containment protocols and advice from our experts. I am told that bars are neither requiring their patrons to observe social distancing nor asking them to wear masks, and they seem to be under the impression that sanitization at the door is a sufficient requirement for service. What I find ironic, and this is a very unfortunate part, is that it is those same business people and business owners who pleaded with the president to reopen the businesses because of the hardships they were facing as a result of the closures. I plead with you to work with us in enforcing measures in order to stop the possible escalation of the restrictions. Besides, public gatherings, including burials, weddings, and even political rallies, seem to have resumed with total disregard to advice given by this ministry. Leadership is not just a position. Leadership is leading by example. If leaders do not observe the measures given going to political rallies and other gatherings, the signals that they send to the public is that all is well. Yet we know that it is not. I appeal to leaders, particularly political leaders, to show leadership at this time and model best behavior to our people in regards to COVID-19 spread and pandemic. Somebody has to take responsibility, and it must, and it will, start with political leaders, business owners, and the organizers of events that attract large crowds, that are against the protocols that we have set forth. And no matter how much we preach to Kenyans, if we, the leadership, do not lead by example, we will simply be singing a song that Kenyans will not believe. And I'm therefore, and this is the advice given by the National Emergency Response Committee today, is to appeal to our people, especially the leadership, to simply adhere to the rules that we have given. This appeal goes to many people, including political leaders who are forcing large gatherings, no idea about masks, and it is no wonder then that the kind of figures that we are seeing have gone up. Today, 685 persons have tested positive for the virus from a sample size of 4,912 in the last 24 hours. This is a positivity rate of 12%, up from around 4% when we relaxed the containment measures. Therefore, a total of 44,881 persons have now been confirmed positive in our country, with a cumulative tested persons of 621,976. 635 Kenyans are Kenyans, while 50 are female, while 50 are foreigners. 456 persons are male, while 229 are female, with the youngest being a 1-year-old baby, while the oldest is 99 years old. In terms of counties, as I had said earlier, there are some counties that are now beginning to be of concern. And you will remember that when the disease started and some counties were more heavily affected than others, we had to take measures to contain those counties, restricted movement so that people could not be able to, so that the disease can be contained without people spreading it to other counties as well. Today, NAC advised that even in those counties, that the county governments take strict measures to ensure that, number one, all the health workers there have got personal protective equipment, and this is available. Secondly, is to ensure that in social gatherings, distances are kept. Thirdly, we are asking enforcement agencies to ensure that we enforce the current containment measures, keeping in mind that responsibility for containment of the virus, as we have said many times before, lies with individuals. It is an individual responsibility to put on a mask. It is an individual responsibility to keep the distance, and it's an individual responsibility to keep on washing our hands. At this time, when our children, or some of our children, have gone back to school, this becomes even more critical and even more important, so that we do not have infection rates beginning amongst the children. Worthy of note today is that we are also witnessing high ICU cases, including in counties such as Isiolo, where there has never been an ICU case, but now we have them. Today, we have 28 cases in ICU, and closing very quickly towards 1,000 admissions in health facilities. This is not even counting those who are in home care. So, ladies and gentlemen, there is no doubt that we are witnessing what our modeling team this morning were calling a case of new infections. We are heading for a second wave without doubt. We are also witnessing higher cases from prisons and other institutions across the different counties. As mentioned earlier, there are some counties that are of concern, Nakuru being a particularly high one, and we are asking Nakuru residents to be on the lookout and to know that cases are rising rather sharply in that county. Nairobi as well is beginning to show a steep upward swing, as is Mombasa at 73 today, while in the previous days it has been much, much lower. I will be distributing the list to the media so that they can be able to inform the country, county by county, what is actually happening. We have some recoveries as well. 105 people have recovered from the disease, 73 from home-based care program, while 32 have been discharged from various hospitals. The total recoveries today stand at 31,857. Unfortunately, you will remember yesterday we lost 12 people. Today we have lost another 7 patients with the disease, bringing our total fatalities to 832. And our sincere condolences go to the families of the bereaved. Finally, let me say this. We need to reflect on these numbers, and especially the rising positive cases and deaths. If they don't mean anything to us, then please let our loved ones count. Because when all else fails, it is our sacred duty to protect them. Remember, as I have said repeatedly, we cannot afford to treat this disease normally. Let us not go back to normal behavior. It will hurt us if we do go back. So please take caution and do the needful. Wear your masks. Stay at home if you can and work from there. Social distance at all times and sanitize. I want to thank the members of the Fourth Estate for your unwavering support and continuing to eliminate the status of coronavirus in the country. Sometimes we appreciate the frustration. We appreciate the fact that it is taken for granted. We have said it for so long that we believe there is possibilities of fatigue setting in. There is fatigue among the citizenry for being asked to behave in a manner that they have not been. Probably people thought it is something they were going to do for a couple of months, and then it was going to end. Sadly, I must tell my fellow Kenyans, be prepared for the long haul. This is not going to be a short-term issue. Secondly, I am also appealing to our enforcement agencies. We realize that after more than 7 months of doing the same thing, it is obviously fatiguing and it's tiring to continue doing the same. But I must ask you that we cannot and we must not relax at this time. This is the most dangerous time for us to do so. So, fellow citizens of this country, I appeal to you, let us rededicate ourselves. The individual responsibility and the concept of individual responsibility is what made us relax the measures when the president announced them. We must not, as a result of individual irresponsibility, allow ourselves to go back and take the same measures that were there in order for us to start containing this disease once again. What happens tomorrow, whether the measures are escalated or not, depend purely on us, Kenyans. It depends on the business owners. It depends on the people in the streets. It depends on us, the political leaders. And it depends on leadership. NAC today proposed that the Interfaith Council also hold a meeting to discuss what is also beginning to happen in a lot of the churches, and so that they can also be able to advise us accordingly. Thank you, ladies and gentlemen. You can now take one or two questions.
Good afternoon. I'm Purity Museo from KBC. You rightly said that we are maybe headed to the second wave of the infections, and when you are comparing the COVID-19 with the Spanish flu, you said we might be expecting something serious than what we have experienced during the first wave of COVID-19. So when that was announced, when COVID was announced in the country back in March, we saw some measures being put in place, including closing of schools and other restriction measures that were imposed. Maybe because you just confirmed that, are we expecting any more measures, because it's more than 7 months on and social gatherings still ongoing, especially from the political leaders and other areas that you've mentioned. Are our children safe in school? There are those who've gone back to school. Are they safe there because the cases are increasing? And then question number 2, when the cases were going down, we saw not really reluctance in testing, but the testing, especially in the country, was reduced, the capacity, because of the capacity. So are you going to re-embark on mass testing, or what plan do you have to really establish the extent of this second wave of infection? And then to DG Amoth, maybe from what scientists are saying, we can talk about the severity of this pandemic, because African countries are still not struggling with the severity, still experiencing the mild, the asymptomatic type of COVID-19. Maybe that's why people are reluctant. So what is the science saying? On the deaths, so many people are dying. So how many people have died from homes, and how many have died from the health facilities across the country?
Thank you, Purity.
My name is Mwangi Maina from TV47. We have seen people who have gone back to schools. They don't have face masks. There are no facilities of washing hands and all that. And CS Rashid Aman said that we might be forced to close down schools in case the curve continue to rise. What is the ministry doing towards ensuring that our children are safe in school? Secondly, the question on the political rallies and gatherings. There are, like today, there is a rally somewhere in Embu. What is your take concerning this as a ministry? Are you disturbed? Are you concerned about this? Then the Nairobi Metropolitan Services was taking mass testing in Nairobi. We've seen not many Kenyans have turned up for the mass testing. What is your appeal to Kenyans and the virus burden we have in the country as it now? Thank you.
Thank you, Mwangi.
Sada Hassan from Standard Group. My question is on the political rallies that we're seeing in the country. Several measures have been taken by the police authority in terms of arresting Kenyans who are seen walking in town without face masks. But if we look at the political side, nothing has been done. Isn't this a contrary to what the Minister of Health is appealing? And then the second question is on mass testing that we're seeing. Are these numbers is actually on the numbers that you've presented today? Are these numbers what we have today, or this is still a backlog that we were witnessing in the country last week and the other week?
Chumutai going from Citizen TV. Possibly the questions that I wanted to ask have been addressed, but maybe just to give a bit of clarity. In the last about 3 days, there have been over about 70 deaths, and there's a bit of concern regarding the high number of people that are succumbing to the virus, whether it is those with pre-existing conditions or those with none. So possibly maybe DG and Waziri can tell us about the condition of the death and the testing capacity that we are seeing now. Today there are 4,000 samples that have been tested. Initially we had seen that the number of testing had gone down. There was a point where there was 1,000. So is it that this increase in number of the new infections, is it because of an increase in testing, or is it that the virus has permeated far and wide that it can be traced to everywhere? Thank you.
Okay. Thank you very much. Let me just respond to some of them, and then perhaps Dr. Amoth can talk to some of them, and also CS Mushero will also say something about what we are using in terms of ICT to support the same. First, Purity, on the issue of the safety of our children. The safety of our children depends on the behavior of the parents. The first line of defense of our children is the father and the mother of the child. Long before you bring in governments, long before you bring police, the first line of defense for our children is the father and the mother as a God-given responsibility. If you go to a crowded pub, you remove your mask and get into these interactions where people believe, and you know what happens when people start getting drunk in bars for some odd reason, and I know this because I was also young once and I did it. No, it's the truth must be told. For some odd reason, people don't believe they can hear you even from a meter away. They keep on coming closer and closer, and especially then, they have got the tendency, even when they are wearing a mask, they begin to believe you can't hear them. So they pull down the mask so that they can talk to you as closely and as intimately as possible. When you do that, the chances of getting the virus, of being infected, are very high. Now, it is the same young person who has got a kid in standard 7 or standard 8 or Form 4 who is doing an exam. And you go home and your little daughter or your little son is going to jump on your lap, and you know what you are doing last night. The least you can do is avoid. But of course, nature is such that you won't do that. So you will infect your child. And it is a gross violation of the child's rights and a gross abuse of your position as a parent. Therefore, Purity, to your question, the first line of defense has to be the behavior of the parent. You know very well what's going on. So you need to observe the measures that you know can protect your child. That's number one. Number two is related also to what I think Mwangi asked in regards to the face masks. And the Ministry of Education, I'm aware, is working very hard towards ensuring that there is supply of water and so on. But not every school at the moment has it. And you know, it doesn't hurt to carry some water with you. I mean, when you were in school, we used to carry water with us every day. You know, when we were little kids, 10-year-olds, 7-year-olds, we used to carry water with us to clean ourselves. And then, on the issue of masks, I agree that there are those who the government can assist and give a mask. But surely, if you have been able to buy a uniform And a mask is so cheap. Now they are selling them at very cheap prices. We will supply what we can. But these things are even being made by tailors in the counties now. So you really cannot excuse yourself for a child not having a mask. And there is a demarcation line that ends where help stops and irresponsibility begins. There is a demarcation line pahali ambapo serikali inaweza saidia, lakini hata nyinyi mnajua kuna pahali ambapo huwezi kusema hata kutoka hapo ni serikali tu itasaidia. You cannot absolve yourself. You cannot absolve yourself of every responsibility. On the issue of testing, and it is true that our testing levels sometimes are directly dependent on the availability of the reagents that we have. Currently we are lucky because we have reagents, and that's why we are testing at higher figures, and it is still targeted testing. We are not yet doing mass testing of everybody. We are target testing. And yes, it is also true that while the figures we are announcing, the 695 figures, are obviously as a result of increased testing, what I would really like you to wash on is the positivity rate. Because irrespective of the number, that is constant, and that when you compare the positivity rate, you are comparing oranges with oranges, and therefore are able to tell. And when in spite of the large numbers, we are now down up to 12%. So when you get to 12%, then you have got a large number of people, then it tells you that there is serious community spread of the infections. I will let Dr. Amos talk to the current nature of the disease. And even as we do so, let us also observe another measure that is important to look at. And that is the number of persons who are going to hospitals, the number of persons who are being held in hospitals, the ones who are at home, and just the number of increases that you can see in terms of persons going to be checked in healthcare facilities. And the ultimate aim is to ensure that our health facilities are never overwhelmed. That's the key to success. Everything else notwithstanding. Mwangi Maina, you asked about the political rallies. And as I had said during my formal remarks, leadership is not just a name. Leadership is not just a position. Leadership is when you know what is happening. For example, you know there is a spread of a virus. You must take responsibility to contain the virus. When you do the opposite, then you are not leading. It is not leading. Then you are not leading. Then you become a heckler. And the point is that as political leaders, we must honestly begin to lead again. And there is no reason why the government would have to tell the leaders what to do. The leaders are the ones who should actually be telling us that because of this disease, because we can see a second wave is beginning, please stop all gatherings. We are not going to call people to rallies. We are not going to have roadside shows because we know for a fact that this is going to have an effect on fellow Kenyans. So we don't want this disease to spread so much that it begins to acquire political names for the reason why it is spread in the first place. And I think we must take responsibility and own up and appreciate that going forward, if Kenyans begin to fall in the streets, political leadership that is creating those gatherings must take responsibility and own up to that fact. The people in bars who are allowing, like the ones now I'm told in Langata Road, which we had closed a while back. Now I am told that there is even a new dance that is now the main thing in those bars. I can't remember, it's Jerusalem or something. That it is the main activity now. That once Jerusalem gets in, all measures go out. Please, can you dance Jerusalem keeping social distances? You know, nobody is stopping people from dancing, whatever it is called. But at least you can be able to dance keeping a social distance. I'm told it's not an intimate dance where you need to hold people. So, anyway, Saada, Hassan, mass testing. No, we have not yet gone into serious mass testing because of the two reasons that we give. A, it is really why it is necessary, and B, the affordability. As we have explained before, it is expensive. So we tend to look at the areas where we know we must test. For example, as kids begin to go to school, as universities open, we are discussing with the Ministry of Education so that we are also able to make ad hoc visits and tests to see whether it is spreading in those institutions. So Shemtai, as we get more reagents, we test more. But we are also aware that we don't want to test to the extent that is wasteful. So let me ask Dr. Amos to respond to the other question.
Thank you, Waziri. Thank you, CS Musheru. Just to add on to the issue of the safety of children in our schools, is that we have developed protocols and guidelines together with the Ministry of Education, and we are supervising and monitoring the implementation of these protocols in school through the county health surveillance teams. But the surveillance teams are also on the lookout for any surge in number of cases in schools. So we have trigger actions that will be able to alert us if something is happening in a particular school. But of importance is also the need to shield pupils, teachers, and auxiliary staff with coexisting medical conditions to ensure that they stay safe because of that frequent interaction. Remember, this was also the reason why we had first opening, so that we could be able to ensure that we maintain the public health social measures, including physical distancing. The severity of the disease, if you listen very carefully to Waziri's statement, the disease is severe in those who are over 58 years old, especially in our setup, even though that population fragment only accounts for about 4% of the total caseload. In terms of mortality, they account for more than 50%. So if you are more than 58 years old, you get COVID disease, you have a 50% chance of dying. Of course, notwithstanding the other risk factors, including morbid obesity, diabetes, cardiovascular diseases, and other coexisting conditions. Regarding the nature of the disease, we are monitoring very, very closely again. If you go back 2 months or thereabouts, our admission rates were about 450 cases in all the institutional facilities. Today we have 991. So that figure has more than doubled in the past 2 weeks or so. That tells you that whatever is happening at the community level is that we have widespread community transmission of the disease, and more people are coming to the facilities. If you also look at the critical care, we are in numbers below 10. As of today, again, we have 28 people in ICU, 10 of them under ventilatory support, 14 on supplemental oxygen, and 4 under observation. Again, telling you that we are getting more severe form of the disease. And what is also unique in this second part of the infection is that all age groups are affected. We are losing more and more people who are younger and who don't have any coexisting medical conditions. So the more the need for us to be able to take the necessary precautionary measures as we have continued to articulate. Testing has been a real challenge worldwide over, and now we'll even face more headwinds. As of today, we are in a better position to be able to test, and that is why, together with the Nairobi Metropolitan Services, we have commenced on a mass testing to be able to tell us the magnitude of the pandemic in Nairobi County. But also you remember that what is happening in the rest of the world, including Europe, more and more cases are being reported, and therefore going forward, more reagents will be required. And of course the first world countries, because of their ability to marshal huge resources will always get first priority. That is why in our testing we'll continue to be guided by our testing strategy, which talks of those who meet the test definition criteria, symptomatic cases, and contacts who also exhibit symptoms. Ideally, the best scenario would be if we were to test one person per 1,000 population. Looking at our population in Kenya, if you estimate that at 50 million, then per week we need to be doing 50,000 tests. Therefore, per day we need to do about 7,000 tests. Now with the kits that we have, we are headed that direction. That will tell us the true picture of how the pandemic is evolving at the community level. Again, in terms of death, the other thing that I need to emphasize on is better data collection, because we now have desk officers at the Emergency Operations Center who link directly with the counties to be able to pick up the data as soon as we get the information. Then we are able to update our line list. We can be able to provide a breakdown on the number of deaths based on at home and also the facility, but majority of our deaths have continued to occur at the facility level. But of course, if you look at our case fatality ratio, it has remained around 1.8, 1.9% compared to the global average of 3.2%, because each and every day our clinicians, our doctors, our nurses, our lab scientists continue to learn and are able to implement measures that have gone a long way in saving more lives. Thank you, Waziri.
Thank you very much, Dr. Amoth. One more thing before I hand over to my colleague, CS Mushero, is also in regards to what Mwangi had asked earlier, and I think also Chemtai, the issue of the political rallies. Let me also add one more item. And this is to say, sometimes even the citizens themselves make it very difficult for the politicians not to have those rallies. Because if a politician is driving around or getting out of a meeting and you gather around and you stop the person, the politician, from moving, you cannot really blame that person for beginning and starting to address those people. So it is not just the political class, it is also citizen responsibility to realize that as you go towards the political rally, you are exposing yourselves. So don't blame just the politician who is standing on the roof of a car and addressing you. Blame yourself also. If you are not there, they won't be there. I have never seen a politician stand in front of a Miss Chamber with nobody and then start making an address. So it is not just them, it is also the citizens who crowd around the vehicles and then make it impossible for people not to have those sort of political rallies. And I thank you and pass it over to CS Mushero.
Thank you very much, Waziri. Mine is really brief, is one, to thank the media and to thank all those that have continued to put a lot of effort in ensuring that we continue to contain this pandemic. We were hopeful that it was reducing and that we would be able to see the end of it. And unfortunately, we are seeing it actually growing, as you have actually indicated. More importantly, during the NAC meeting, or the National Emergency Response Committee meetings, the discussions we've been having is what this means. For a long time, over the 7 months, people have been asking, please open the economy. And we've been opening the economy. The President has looked at ways of ensuring that our economy continues. But if we lose this individual responsibility that we're supposed to have, then we go back to a situation where it's now between health and the economy. And health will always be the one that takes preference. So mine is really to urge Kenyans, please, please take personal responsibility for yourself and for those around you. Take care of the country, because we need both the economy as well as yourself. But the trend that we are now seeing, it's getting to a position where measures may need to be taken. And if they are, then we will end up even with more suffering. Please, media and all the people involved, don't tire. Continue with the efforts that you're putting in place. It looks like the battle is going to be bigger as we continue, and we need you to be strong. We need you to be committed as you have been, and we look forward to being able to win this battle. Please just take personal responsibility. Asanteni sana, Waziri.
Thank you very much. There's just a small tank problem upstairs. So we are just sanitizing. Thank you very much.
Super.